We're going to start our lesson on the heart talking about some of the pretty amazing kind of statistics, if you will, associated with the heart and the contractions and how amazing your heart really is. So the main function of your heart is that it contracts and it pumps blood throughout your blood vessels. So the interesting thing is that your heart is required to be able to pump blood all the way down to the tip of your big toe and then back up to the heart, and also to the top of your head and back to your heart. On average, it beats 75 times per minute, which means it beats about 108,000 times per day, which is about 39 million times per year, which is about 3 billion times in your lifetime. So that's pretty impressive that your heart starts beating before you're even born, and it will be approximately 75 times per minute until the day you die. Each contraction ejects about 70 milliliters of blood. So, for each minute, about 5.25 liters of blood pass through the heart, which equals 14,000 liters per day, or 10 million liters per year. So, now, granted, you don't have 14,000 liters of blood in your body, but that's how many. It's the volume of blood that passes through your heart during the time frame given. So 14,000 liters per day that is pumped through your heart. That's really impressive. The heart is located in the thoracic cavity, which is the chest cavity. And there is an area kind of between the lungs called the mediastinum. And then within the mediastinum, there's an area called the pericardial cavity. And that's where the heart is located. Your heart is about the size of your fist. It is larger in athletes because just like any muscle, the more it's used, the bigger it will get. Having a larger heart in athletes is normal, although there are some kind of different conditions that can cause an increase in heart size, but not necessarily in a healthy way. So in an athlete, their heart is increasing in size because they are working out and they're using their heart more. But in other diseases or disorders, the heart might increase in size because it's trying to work harder to pump blood, but not for the reason of working out, more for the reason of maybe there's a vascular disease or the heart just isn't working as efficiently as it should. And that's called hypertrophic cardiomyopathy, and it can be very dangerous and lead to heart attacks and other problems.